his story with Dr. Joni Collins as she demonstrates how she is able to revolutionize the healthcare industry by being a meaningful legacy creator, tapping into regenerative medicine for prevention and treating the root cause of diseases, as well as creating a new way of patient collaboration and team collaboration to strategize for business growth.
Healthcare entrepreneurs, are you ready to rewrite the rules for your business so you can have more time off, a great team, and more income while creating a positive social impact? Then you are in the right place. Welcome to The Provider's Edge. I'm your host, Sabrina Rumbach. I'm a provider, an international peak performance keynote speaker, and a best-selling author. Let's open the gateway to profitability for you today. My guests and I help healthcare entrepreneurs and startup founders like you break through barriers so you can control your business, control your life, and control your future. This is your defining moment to be a disruptor in healthcare.
Hi, everyone. Welcome. This is your host, Sabrina. Today, we are excited to feature another PA-owned practices, Dr. Joni Collins, and she has a variety of background in different subspecialties, and I can't wait for her to share with you guys what she has been able to accomplish, all the amazing things that she has even trademarked for. Hi, Joni.
Good morning. How are you?
Good. And thank you for being here with us. So I know I can never do the best justice when I introduce my speakers. So I would love for you to share with us a little bit about what has been for you to be on the journey of medicine and how to take all the winding roads and guide you to this point right now.
Goodness, thank you so much for having me here today. So my name is Dr. Joni Collins. I am a doctor of osteopathic medical science and a physician assistant or physician associate, as we now call ourselves. Also a certified aesthetic consultant. And I've been in practice over the past 17 years. And my journey has somewhat pivoted, just as a lot of us had to in the pandemic. So I have background all the way from neonatology, NICU, to interventional cardiology, internal medicine. I actually worked in reproductive endocrinology, trauma, facial plastics, head and neck surgery. And in 2015, I was picked up by some investors, started an aesthetic center, and present day currently have my own aesthetic center and training center. And I specialize in regenerative, aesthetic medicine, and precision medicine.
That's amazing. I think the new current trend has been into regenerative medicine. People are not just looking to heal a problem and disease, but how can we prolong and live in a better way as we go into our older age. And then nowadays, we know being older is not really an issue. It's progression of life, yet that should not be seen as something we can not do anything about. So I love that you have a focus on this area. So what brought the passion for you to focus on this particular subspecialty?
So I have children. I have beautiful twin daughters that are 13, and being a mother on bed rest for 8 months. And just, seeing the interaction and how important it is, the personal touch and just the whole full circle that the body is completely connected. And more than anything, not only treating and diagnosing, but preventing and curing, right? So in the United States, we do a lot of diagnosing and treating and a lot of side effect treatment, right? But our goal in regenerative medicine is to see the body as a whole and even take it a step further with precision medicine and take your own, medical history as well as studies, genetic history, and give you the best option for the best, prolonged or, most extensive, awesome life you can have, living it to the fullest in a healthy manner.
Exactly. And how many patients do you typically care for in a day nowadays compared to some other specialty that you have worked in?
I'm really spoiled. So back in the day, I would say I had to see about 50 people in the hospital when I did cardiology. And I'm very thorough, so that was very difficult. I also probably could talk to a tomato. So getting me to be quiet is a little interesting. But, I would say today I see about 6 people a day, 6 to 7. I get to spend about an hour with each patient. So that's huge.
Right. It's almost unheard of for us to be able to spend a whole hour with any patient in a traditional medicine model, and to be able to spend extensive amount of time. I know also your appointments are procedure based. Mm-hmm. So have you seen on a daily basis the changes also as you are running a practice as well as teaching others to create their own practice in aesthetics and regenerative medicine? How has that been shifting both mentally or really seeing how your time are divided?
I'm just so much more fulfilled. At the end of the day, we always say educate, empower, serve. And, my name for my business is 1228, and it's about using your skill set to serve others. And so to me, I used to feel so rushed and stressed because I would be concerned about the patient and did I do this or this? And I know I did it to the best of my ability, but I'd always question because of timeline. So what's really neat about this is it's a spiritual journey with the patient. And we're not only treating physically, but mentally and spiritually. So we get to know the patients, their family, their children, their significant other, their dogs, cats, and I even encourage them to bring them with them. So we address, again, the full picture. And in saying that, I sleep better at night knowing that I had this quality time with the person. I really get to know them. And the procedure time actually has shortened because they're more comfortable. So when the patient is more comfortable, I know them better. They trust me as their advocate, right? And in the procedure, I'm not having to change things up as much because they're so comfortable that it's easier for me to do what I do best, right?
Yeah, exactly. It's all about human connection at the end of the day, how we constantly building rapport with our patient and their family and engaging that part. With that being said, how has it been? Now you are not just a clinician, not just with a big hospital group or a private group seeing patients, but now you're wearing the hat of a business owner.
So as a business owner, what I love about being a business owner is that I've learned through my failures and I've learned through my success, and being able to pass that on to create a legacy is huge, right? So last year I was able to teach 68 women who started their own business. So to me, the biggest gift as an entrepreneur is learning that skill set, what it takes to run a business, understanding the profit, the loss, getting your cost of goods down so the patients can actually have, not as expensive as a procedure, but also have an excellent outcome, and being able to teach that to other providers. I will say, people don't go into medicine because they don't like people. All providers, we love people, right? And so at the end of the day, medical providers, we want the best for our patients. We care about them genuinely. And so to be able to pass that along of caring for providers that, who knows, one day could take care of me or my family or friends, it's important. And so I'm very thankful for failures because I can teach it to others, but I'm thankful for success too, because it's the passion of the drive, right?
Right. And at the end of the day, when people become entrepreneurs, we really have to think about it's not just creating a business for ourselves and with the flexibility that we control, but it's about creating jobs for others, is be able to share the knowledge with others. And that's one reason we're here now, is to have this show to highlight the ones who has achieved a level of success. And then we can collaborate with each other, sharing those amazing knowledges and teach it for each other. And that's how medicine stop being silos, but collaboratively be able to create that strong networking system. So what do you think is more important when you switch the hat as a business owner, as a leader, and as an educator teaching other people? What are some things you want people to know and definitely not see them as perhaps narrow roadblocks that you have gone through that you're hoping people won't get into the same spiral?
Oh my gosh. So I think as providers, as PAs, we're always saying, we want to have autonomy, but in the same time, it takes time and it takes cost of goods and money, right, to be able to have your own business. And so I can remember apologizing sincerely after I started my business to one of the plastic surgeons I worked with in Florida, because I had thought I was making all this money for the practice. And I was like, yeah, I'm seeing these many people and I'm getting, these many patients. We're so happy. Things are great. And, when you look at the return on certain items, I was not making anything for the practice. She was kind enough just to have me there. So what I try to get providers to know is money's an exchange of energy. And my goal at the end of the day is not money, it's to pay my bills, to take care of my family and my patients. But it takes capital, right, to be able to provide. And so what I like teaching providers is not to take anything for granted that they have at their current, position or what they're going to be offering. And, it's a blessing to be able to be an entrepreneur.
Yeah, I think that's a great point is that when we are just an employee, doesn't matter if you're chief of the department, as long as you're part of the bigger organization, if you're not understanding the back end of how admin works, client acquisition, accounting, and then training, retention, and also how do you want to make sure that you keep your patient happy so they continue to come back to you? Or at the same time, even you keep them happy, perhaps they just don't remember to come back. We're also seeing that in multiple different specialty that perhaps people should be coming back to you once a year for that checkup, but life also get in the way. So how do you keep everything smooth and moving? That's a lot more than having patient already right. On your schedule, and then you're seeing them, right? And I think traditionally always see is this is the type of work I'm doing. I do a good job of it. And then I left. But when you're a business owner, a leader, who are truly actually need to lead, we have many different things we need to think about. And then you brought up a great point, capital. We do need money. If we have no cash flow, nothing works.
Right. And there's ways to tweak that, right? I mean, at the end of the day, yes, money helps, right? I'm not money motivated. And that's where I would say as an entrepreneur, it takes someone who genuinely loves what they do. Because if you don't love what you do, you cannot fake it. There's eventually a burnout, right? And so I would say if someone is interested in aesthetics and regenerative medicine, that's where that passion comes in, and it doesn't feel like work. I love what I do, almost to a fault, where my kids say, "Mom, come on, let's go." And I'll say, "Just one more minute." I'm researching all the time, or, besides the accounting and the marketing, really can just be marketing yourself when you love what you do. And I'll be honest in saying humbly, I don't really have to remind people to come back because they want to. So that's a huge blessing in the business that I have.
Right. And that tie into what you mentioned, you brand yourself. At the end of the day, as providers, as a business owner, we have to also stand out there as a personal brand. It's not just the name that you have built for your practice, for your community. Yes, there's always a purpose in that mission that you're driving, in a vision that you have created, but that also needs to align with you personally, how you present yourself, both in front of patients and virtually, and speaking on podcast shows and stages anywhere, and perhaps it's LinkedIn, it's wherever your patients are hanging out with, or people who are your other subspecialties that you wanted to collaborate with. We all have to present ourselves in the best light possible.
And be comfortable with yourself, right? To be true to your authentic self. Because at the end of the day, if you're not who you are, then who are you, right? I mean, that would be exhausting.
Exactly. And that's how we have to all show up. It's not just like, oh, I wrote this mission statement, people agree upon it, and then we understand our purpose, let's go for it. If there's not a deeper connection to those meaning, then it's pointless to even have it out there. So of course, that also come back to, we don't work by ourselves. And when you are growing practices, doesn't matter if you are the only provider or you have multiple provider that you're supporting in your practice, there always need to be in a team base, which means we can't do things by ourselves a lot. So how big is your team nowadays for everyone? Consider the billing, the marketing, the back end, everything together. How big is your team now?
So before I bring someone on, I always think of, if there was another shutdown, am I going to be able to provide for this person? Because it's again, that exchange of energy, but also this person becomes, into the family of my practice, right? And the brand being is, who's this authentic person? Are they authentic to themselves? What are they on and off, and they check in, check out. And so I have several people surrounding me doing things that I am not good at doing. And so I've learned I can't do everything. Burnout would be huge, but I have several different players. So I'd say about 7 people help me with different things. They're not all full time. I have a lot of 1099 because they bring their own things and they come help, right? But most definitely, I have to work on too, letting go and trusting. So that was a big fight for me at the beginning, was learning to let go and trust. But when you have that team, oh my goodness, it's a massive difference, right? Sleep better at night and know that it takes a village. It really does. So I'd say about 7, and I could go in detail, but I don't want to bore you to death. But I'm very thankful for everyone. I couldn't do this without help, right? It takes a village.
Right. And that's one thing I always talk about, even one of my signature talk on what are the 5 things we have to consider when we attract these A players to our team. And it's the same concept when we're thinking about collaborative engagement and how do you attract that A player that creates a win-win situation that they're all synergistically supporting each other. Because you're right, Dr. Joni, not everyone is able to play together, right? Mm-hmm. And then perhaps their genius zone in that one area is not ours. Great. That's a great relationship. But that person also has to interact with the rest of the team. So just because people look good on their CV doesn't mean they really fit the culture that you have, the personalities of your team, and really internal drive also has to be aligned. So multiple different things when we're thinking about hiring someone or even retaining that person once they're onboarded, especially the new movement nowadays is silent resignation. People can not show up to your interview
crazy, right?
And then have worked for some time and they just don't show up for work. So for some of us who are like, how is that even okay? That just simply disrespect for
respect. So it goes back to respecting yourself and others respecting others. Like, so when someone comes in and they're looking for a position, to me, it's how much do they respect themselves and how much do they respect others? Because to me, we're all on an even playing field. Yes, at the end of the day, I have to make the decision. But again, to me, everyone is treated, exactly the same. Whether you're the person that's helping clean up the office or if you're the person helping, hand me the threads, it's important. Follow-up calls. To me, it's kindness that is important and just that consistency. And so that even goes back to your program where you do the coaching for people. It's a lot of psychology goes behind it because if the person's not comfortable with themselves, it's going to be very difficult.
Exactly. Just like that person who's answering calls or following up with the patient, if they don't have the proper training on active listening, using the power of question to bring out the concern of the patient, and if they're just being talked to, no one will have a good experience. And we have to also notice our tonality. People have the lower range, the middle range, and the higher range. And some people don't even know where they always sit. And if you're not really talking and empower your middle range and your vocal variety is not really there, and people might think you don't care because you're talking in a monotone or you talk a really high pitch and they think like, are you so young? Are you so knowledgeable? All those things we have to consider.
And it's funny you say that. As you say it, I'm thinking, I'm pretty confident in myself. However, I may have a high-pitched voice when I'm really excited. So I'm spot on today. Kidding. But you're absolutely right. I mean, just that authenticity, right? And I would say, to me, I'm not looking for a specific voice, but you would be in your industry. To me, I'm just looking for someone that works hard consistently, who's kind and wants to serve others. And not afraid. The biggest thing I would say, and this goes with entrepreneurs and it goes with people that you're working with in an office environment, they have to be able to say that they've made a mistake or they don't know. Because when you don't agree to say, hey, I have no idea, but could you help me? Or you don't fess up saying, hey, I made a mistake. I need some help with this. How can anyone help you? Or how can you help yourself? Right? It's huge. That's how people get hurt. And so even in teaching, that's one of the first things I teach about practicing medicine, being an entrepreneur, is you've got to even be honest with yourself to say, hey, maybe I'm not doing this the best way. This may not be my wheelhouse. Let me get some other people to help.
Exactly. So spot on. So I know we are all loving to be the best at what we do and then growing in many different areas. So in every stage, perhaps, of our life, but what are you currently working on or hoping to uplevel right now?
I'm really excited because in 2018, the FDA had tried to have a lawsuit against a company called Cell Surgical Network in California. And under the direction of Dr. Mark Berman, who's brilliant in stem cell research, traumatic brain, and research arthritis and regenerative conditions. And as of this summer, the ruling was overturned. And so I will be practicing more of stem cell therapy, autologous, meaning from yourself, from your fat, where we take that, we can harvest it, we can actually purify it through a system, and you get to use your own healing factors within to heal yourself. And we can replicate it as well in the lab, and then freeze it to keep on kind of like a back order, right? Sean Berman is brilliant. He's out of California with the Cell Surgical Network. It's Mark Berman, Dr. Mark Berman, who passed away. It's his son. And so I'm ecstatic. I feel like I won an award, like not a word, like the best gift ever besides, my kids and my significant other, is that being able to help others truly from regenerative state. And that's what I was saying, not only just diagnosing and treating, but preventing and curing. Like, who thought, right? So there's over 12,000 patients, over 200 publications, IRB studies of this. And I'm excited to see people's lives change completely.
Awesome. Amazing. So one of your major up-leveling is in your career side. Any other area of your life that you wanted to focus on?
Oh gosh, my children always, right? I think as mothers, we're always wondering if we're doing all we can for our children. 13-year-old girls don't run when you say it, right? But they're actually amazing girls. One rides horses, the other does dancing and musical theater. So being more present, right? And learning that when I leave the office, being there for my patients is also being present in the moment. And so I'm trying to level up to have that vision of work, but have that vision of legacy in my children, but yet being in the moment, but not stuck in the moment, which is hard. So that's my personal goal right now, is to work on that one.
Yeah, I think that's also amazing. That tie into what you mentioned earlier. Sometimes you got so excited about the research that you're doing, and your kids have to say, like, Mom, let's go. And then to be able to balance and then shift between what is in the moment, what does that mean to be present, and then how to block the right amount of time for each of the things that you're passionate about in life, in career, in spirituality, and in all those amazing things that you're doing. I think we can all, at the end of the day, reassess on that.
Always a work in progress, right? Always.
Yes, always. And then at the end of the day, our own success picture, how do we think that is different from person to person. And that's okay. We just have to be very clear what that means, and then really be honest and be strong when we are trying to achieve these goals that we are having.
And I would say that's something we always say big. What's your big goal for the day? So what's your belief? What's your intention? And what's your goal? And so I try to have the mindset each morning of what's my big plan for the day? What am I believing in? What's my intention? What's that goal for the day? So it kind of, it makes a little microcosm of your world, and it makes it a little more doable.
Exactly. Perfect. And that's one thing that I always talk to my clients. You guys are already leaders in your field, but how do you do it into the next level? And it's about saying more no's to the opportunities that are distractions. And perhaps at the moment, it doesn't seem like it, but how do we be able to do that? Reduce decision fatigue is what you're similar to what you're saying. What is that top 3 priorities? And perhaps it's now about achieving all of them, but it's to at least give you some kind of guidance that anything else coming into your way, it's an easy no without you have to internally debate about it. Then
trusting your gut comes in, and prayer. Right. For me, that's prayer. So if I don't know the answer, instead of where I used to just say yes or no, I'll say, let me get back to you. I need to check through some things. And sometimes that checking is with God, and just having discernment to trust that. So I'm thankful we can do that, have the freedom to do so.
Perfect. And I thank you so much for joining us to highlight your work. How can people find you?
They can find me on my website. It's 1228wellness.com or at 1228wellness. It's spelled out TWENTY 28. Not the number. I had to be a little longer and consistent that way. Go figure. But they can find me that way on Instagram, on Facebook, as well as LinkedIn.
Perfect. Reach out to Dr. Joni Collins if you wanted to both explore the area of aesthetics, the regenerative medicine, to perhaps add that to your practice, build it completely, or just to collaborate with her if you already have that practice to continue to grow and scale. And at the end of the day, we know scaling means having the same consistent resources, be able to grow into the next level, versus growth means being able to add the right people, right resources, right talent to get to another high level in your life. I appreciate you guys. We don't ask you to pay us for anything that we do, but we ask you to pay it forward. So please share with other people that you truly believe this interview and the series of our podcast will be best for other of your colleagues, and enjoy talking to you guys. Until next week. Bye-bye.
Thank you for listening. Remember, the positive change we're seeking starts right here with me and you. If you are a fan of the show, or if you are just having struggles or success that you're either experienced in the past or are experiencing now in the healthcare industry, these matter to all of us. I want to hear from you. Visit sabrinarumback.com/connect and send me a direct message.